Welcome to our weekly episode of COVID-19 Science in Context. I'm Roshni, and joining us this week is Dr. Katharina Hauck. Earlier this week, the government announced that all restrictions will end in England as of 19th of July. What do modelling projections tell us about the potential number of cases by then?
Cases are projected to reach at least 50,000 per day by this date, and probably higher, 100,000. In worst-case scenarios, these numbers go up to 200,000 per day. Now, of course, there's a high uncertainty around these projections because all differences in the assumptions on how efficacious the vaccine is and how many people are covered so far with the vaccines, they make a marked difference to the projected numbers.
Are there indications of the third wave in the UK seeing more people needing care?
But luckily, we see now that there's a weaker link between cases, hospitalizations, and also deaths. But the link is not entirely broken. Back in January, about 1 in 10 infections could be expected to end up in hospitals. And now this number is somewhere around 1 in 40 or 50 cases. And similar for deaths. In January, 50,000 cases, that would translate into 400 deaths or so a day. And now the same number would result in 50 deaths.
And what impact will there be on hospitals?
If you really have the projected 100,000 cases per day, then we would see a high number of hospitalizations. I mean, today there are already about 2,100 patients in hospital. Over the COVID pandemic, the NHS waiting list has shot up to 5.1 million, which is a record. So if you get hundreds of COVID hospitalizations, then access to treatment needs to be somehow managed. Now, we did some research with the Imperial College Business School, and applying some criteria, we found that more life years are gained if some COVID patients are not admitted to hospital, and instead we admit non-COVID patients, for example, those with cancer or diseases of the digestive system. Of course, there are many considerations for allocating care apart from maximizing life years, and that is patients' capacity to benefit from treatment and others.